My name is Nathaniel Delali Ajabeng, and I am going to be doing a presentation on the topic titled For Teenagers, Does the Use of Early Intervention and Detection Reduce the Future Risk of Drug Abuse? I am going to give a brief summary about the background of the whole thing, and I am going to also list and explain some clinical problems. I'm going to delve into my PICO questions that I used during this whole research, and I am going to also talk about the research strategies. The practical implications will be the final thing that I am going to talk about. Drug abuse is the illicit use of drug, and it is really becoming a public health concern in and among teenagers. And it is estimated that in America, about 1 in 10 teenagers abuse drugs and alcohol either knowingly or unknowingly. And it is becoming a public health concern. Most of the teenagers using these drugs is either due to peer pressure or something going on with them, but I strongly believe that it is having a negative effect on the youth and something needs to be done about it. Hence my interest in dealing with this topic and trying to understand how early detection of signs of teenagers wanting or moving towards or gravitating towards the point of getting interested in using drugs, either as a form of stress release, avoiding problems, or any other thing that is happening in and around in their lives, and helping them find a better coping mechanism or effective ways of handling issues other than getting into drug abuse. And that is the main focus of this research. Thank you. Drug abuse can have significant impact or effects on both the physical and mental health of teenagers. It can lead to a number of serious problems, such as depression, where they become depressed due to the effects of the drug on their system. They have anxiety, and you will see some physical changes in their bodies, and due to the abuse of the drugs, some wouldn't be eating properly, and therefore you have some physical changes in their physical appearance. They are also at an increased risk of overdosing due to the craving for the drug, because a time will come where they will become, their body will become used to the drug, and they will need more of it to get the same effect that initially it was a lower dose was given them, leading to accidental overdose that can have fatal consequences. Hence the need for it to be um, noticed um, or early detection um, to be able to help prevent all these negative effects of drug abuse. This image just brings to mind how excited most of the teenagers are whenever they are using these drugs or they are taking them. Most of them take them um, because they think they want to be high, and some even take them due to the fact that they believe it will enhance their ability to be able to do certain things they couldn't do in the normal circumstances. But all these end up leading to negative behaviors. So you see most of the teenagers getting involved in um, criminal activities, which under normal circumstances they wouldn't have been involved in. Sometimes just in a way to get money to be able to access. With this research, I tried as much as I could to stay within the parameters that were set for it, and um, I did a comprehensive searching of it, and some of the search terms that I used to help me be able to get access to the right information were teenage drug abuse, early intervention and detection, and the future risk if nothing is done about this whole issue. And it did work well and stayed within the APA formatting that was also um, outlined for this research. It is interesting to note that evidence-based research backed by literature has come to the conclusion that early detection and intervention can reduce the risk of drug abuse in teenagers. And I totally agree to that in the sense that it's come to a point of personally understanding that most of these teenagers don't really know what they are getting involved in, and they are not able to look at the futuristic negative effects that getting involved in something like that over a long period or even for a short while will lead them to, and they don't see how destructive it can be because of the current feel or enjoyment they think they are getting from that. Therefore, if it is detected early and they are educated, they are really informed about the negative effects and reasons why they shouldn't get involved in, as supported by evidence-based research, the risk of drug abuse in teenagers can be reduced. Practically, the findings of these research and literature that supports the idea or the conclusion that early detection can help reduce the risk of drug abuse um, is the fact that we all as people and the community and a country as whole must learn how to identify signs of a teenager trying to get involved in drug abuse or is abusing a drug. It lies in the domain of healthcare providers to take a close look at these teenagers when they come for their yearly checkup or for any other reason to ascertain if something like that is happening. It also falls in the domain of parents, friends, family members to take a critical look at the teenagers that are around them. And it again falls in the domain of the educators, the teachers at the various schools, wherever they find themselves, to look out for these signs and symptoms and be able to teach them better coping mechanisms. One thing I find interesting is the fact that the early detection, like any other disease, when it is detected early, and that is about 40 to 50% the possibility of trying to stop it from getting to a worse state. So when we are able to detect teenagers' interest in drug abuse as early as possible, it helps in trying to give them the necessary help that they need to be able to avoid getting involved in that as against getting involved in it. Being proactive is the word that should be echoing in our minds in an attempt to solve this problem of drug abuse among teenagers. It must be noted that most people who have been able to come out of it regret it, and what they will say is if they had known, if there were other ways they could have controlled whatever pushed them into getting involved in it, they would have done it. So early detection and interventions really, like as it helps in other disease processes, can also help in reducing or preventing teenage drug abuse.